Welcome back to Rural Health News, the segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode. What's most urgent, a rural health damage report, and a success story to send us into the week. First, our most urgent news item is once again the ongoing threat of cuts to Medicaid. More real today than it even was last week because on April 10th, the House and Senate completed the budget resolution process, meaning that $880 billion in cuts to the House Energy and Commerce Committee remain in the proposed budget and proceeds to the next phase of reconciliation. This is very concerning. According to a recent report, the proposed cuts to Medicaid funding could lead to a loss of 477,000 healthcare jobs by the end of 2026. Now, that number assumes that $880 billion will be spread evenly over the next 10 years, but cuts could be enacted much faster, we're told this, increasing job loss and hospital closures, even more accelerating them, depending on when those cuts take place. These cuts will immediately impact the quality of care for rural communities. We know without a doubt if those closures happen, it will overload our emergency medicine in urban and suburban areas where hospitals and ambulance companies will be managing to barely survive. Folks, this is real. I'd like to share another audio story from one of our community members here in Hillsdale, Michigan. I want you to meet Jill Snow and her son, James. They rely on Medicaid as their secondary insurance during some of the difficult seasons of their health.
We've been in this community since he's been born, and to have the local care has been an asset.
It all started in October when I had a seizure on the football field on the sidelines.
I couldn't really see anything sitting behind the player, so I couldn't see what was happening, but it was pretty scary knowing that he was down and I had to go see what was happening.
I came here to Hillsdale pretty much as soon as it happened.
You know, they were able to do everything quick and assess what he needed. It was just a lot at once with all his care. So James had a lot of tests and a lot of care here, which is great. And we were able to do a lot of the, main things here, like labs and tests and get them assessed. But then we had to have extra care where we had to travel and get special care, specialty doctors.
None of that would be possible without Medicaid.
Medicaid steps in and kind of helps with that out-of-pocket that, you're normally responsible for, which you still have a lot of responsibility financially. We're driving up to different hospitals and parking and gas and, food for the growing teenager. And so, it all adds up so quick. And financially with that Medicaid helping, to do those tests that I would not be able to afford to have on him, it's important to have. He has been trying different medications, and some medications haven't been kind to him, and so you have to start fresh with different ones. So we've been through a few different medications, and with that's financially, hard. The scary part is being a young man and having these new conditions. He's currently in tech center and early middle college and high school all at once. So he's got a lot going on, and trying to maintain doing all that and then going to the doctors.
I missed the last half of my football season, a bunch of my basketball season. I'm missing a lot of school all the time. And so it's a catch-up game. It really is. Ideally, I'd graduate with all my cybersecurity certificates and 2 associate's degrees from Jackson Community College. And I'd try and get into a help desk somewhere, and from there grow my experience and time and skills in cybersecurity and move up. After graduating high school in that 5th year, I'd finish up at Jackson College and then hopefully go to Michigan State. My worry is that people in the future won't be as fortunate to me to get this health care in a convenient manner and in an affordable way. You know, it's beyond me at this point. It's everybody that will have to deal with this. And I mean, kids growing up too, stuff happens. Life can take a turn any moment. You never know. You know, I was playing football and then 1 second I'm out. It's just how life happens. And if this hospital wasn't here, or hospitals around the country weren't there for me or them, then I'm not sure what we would do.
The convenience of having our local rural hospital is huge, because if it had not been here, just having the wait to go up somewhere else, I mean, we're already making those trips. Those trips are long trips, especially in the winter. So I have to take him out of school longer than I'd like to get him up there. And that's been an effect on his life too. And then if we don't have those hospitals or services, local services, he may not be able to do what he wants to do, because he'll probably have to go out into the workforce right away instead of all the extra college that he wants to do. It's going to be hard.
If you want to see the full video of Jill and James telling their story, visit hillsdalehospital.com/Medicaid or follow the links in the show notes. We cannot wait to advocate for Medicaid. If we do, it will be too late. Right now is our window as community members, as friends, as family, caring one for another, for taking action and expressing our concern with these funding cuts. We cannot let rural healthcare hospitals, physicians, and those that we are receiving our care from be cut from the funding they need to survive. Help us stand up against these cuts by contacting your local representative at MHA.org or ruralhealth.us. Now, on to the damage report. Over the last few years, Medicare Advantage has expanded its coverage, leading to lower reimbursement rates for hospitals since Advantage pays only 90% of traditional Medicare. Many rural hospitals recently announced that they can no longer afford Medicare Advantage contracts, and some have already dropped their contracts due to the cost, payment delays, and difficulty authorizing patient care. Now, we expect to see many more similar contract cancellations in the near future, as half of the U.S. rural hospitals already operate with negative margins, and sustaining healthcare for rural population becomes increasingly more challenging. The good news is that associations like the National Rural Health Association and other rural health advocates are helping bring the case to Congress and CMS to improve prior authorization practices and make a way for rural hospitals to maintain Medicare Advantage contracts. For today's success story, I'd like to share a message of encouragement regarding the headlines we've been featuring over the last few weeks. Rural health is rife with alarming statistics and news. But with every report that stirs turmoil among rural hospitals, we must not forget our hope. Hillsdale Hospital started in 1915 in a doctor's home because he and his wife saw how desperately this rural population needed health care. There are countless stories, like our hospital, being born by the community for the community. In the face of legislation that compromises the sustainability of rural hospitals, let's remember, we have voices. We must use them to advocate at the state and national level, and we need partners to come alongside of us. No matter what comes next for rural health, we can be united in our mission to put every patient first. And that's a success story in the making. Thank you to our sources for this episode: Commonwealth Fund, the American Hospital Association, KFF Health News, and the National Rural Health Association.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.